When David Leibovitz trained to become a doctor in the 90s, landlines were more common than cell phones, and Google was just a funny word. 30 years later, technology has come leaps and bounds, which has created more complex cases and treatments. However, Leibovitz says the administrative arm of medicine continues to lag behind.
So essentially, we have lots more information to manage, increasing complexity of the patients who we are seeing who are now doing well despite this complexity, whereas in the past, we couldn't necessarily help them for as long. And yet the tools day to day aren't that much better. And one might say that, well, wait, we have electronic medical records. We didn't really use them routinely way back in early 90s and 80s. That's true. However, the medical records haven't necessarily made things that much easier for physicians in caring for patients.
Not to mention the rising cases of physician burnout that have only worsened since the pandemic. Leibovitz is a co-director for the Center for Medical Education and Digital Healthcare and Data Science within Northwestern University's Institute for Augmented Intelligence in Medicine. He's hopeful that emerging AI systems will help improve patient-doctor interactions.
Large language learning models like ChatGPT-4 that exist now show the possibility of being able to assimilate, summarize, and provide information to give much more focused information. So patients could ask, what history should I provide my doctor with these sorts of symptoms that I'm having? And they could respond back, oh, here's a set of information. They can enter all their information. And then that information a patient could enter, AI, for example, in this sort of pre-visit, pre-getting to the doctor interaction, could then be summarized. Oh, here's how we're going to phrase this for your physician.
Which helps prep your doctor for the visit. The time that would have been spent on this background information is now freed up for more detailed follow-up questions that will lead to more meaningful answers. Leibovitz also points out that AI has the ability to help doctors with mundane tasks, like note-taking.
One of the complaints that patients sometimes have is the doctors, typing and not making eye contact with the patient and just putting things into the medical record because it takes so much time and, it's going to double the time if you don't do it later. And even if you try to do it, it still doubles the time from some reports. But here, how about a patient and physician just talk and there's the listening device and there's some commercial solutions that are improving an ability to do this, but not only verbatim record the information, but now with these new tools, reformulate it in a nice, concise summary, the way a physician would have written that information.
This technology could also take over the task of sending prescription information to the pharmacy post-appointment. The doctor would simply have to confirm that they have the correct information on file. Unfortunately, Leibovitz says there's still a lot that needs to be done before this can become a reality.
These tools aren't ready for prime time, and they need that expert supervision at this point, just like a textbook, and a patient looking at a textbook is not going to help. Here, though, it's getting a bit more personalized. It's their content that it's reviewed, but even still, nowhere near that expert level. And there's wrong information that might be distributed. So we have some concerns for how it might be at patients, but I'm just opening that up as something to think about for our future and how we plan for this sort of event.
While widespread patient interaction with AI may be years away, artificial intelligence has already made a big impact on the research side of medicine. Dr. David Baker is a professor at the University of Washington and the director of its Institute for Protein Design. He's an expert on proteins and is using AI in a way that helps scientists better understand these complex compounds.
So proteins carry out essentially all the important jobs in our bodies and in all living things. They digest the food that we eat, they power our movement, they conduct the electric currents in our brain when we're thinking. Basically, everything that goes on in our bodies is done by proteins.
Proteins are often called the building blocks of life. They are in every cell in our body, and they are the foundation for medical treatments. Baker says these proteins evolved with early humans to solve problems like helping us run away from tigers or hunting for food. But today, we have new problems that natural proteins just can't fix.
We live longer, so there are new diseases which are important, like neurodegenerative diseases. We're heating up the planet, we're releasing toxic compounds, plastic is accumulating everywhere. So there are all these problems where new proteins could really provide solutions.
But we can't wait another billion years for these proteins to evolve. Instead, Baker is one of the scientists working to create new proteins to combat the problems we're facing today.
The first thing we tried to do was to simply make brand new proteins that didn't exist in nature. Every protein has a unique shape, and that unique shape enables it to carry out its biological function. So the first thing we tried to do was just to make a protein with a new shape, and we were able to do that. Now the problem is harder. We don't want to just make proteins that have shapes. We want to make proteins that do things. And how long it takes to make proteins that do things really depends on how hard it is and complicated it is, the thing that we want them to do.
When the pandemic began, Baker and his team set out to design new proteins that would block the virus from infecting us. They created compounds that a user simply sprays into their nose in order to be protected.
And that took us about 4 months. And now we can do the same thing with our AI advances and other advances that we've made that sort of came from that. We can now do the whole thing in just a week or two. So it's very much faster.
Aside from speeding up the process, AI programs can actually invent 3D protein structures that Baker says are extremely hard to create just using human brain power. His team has been developing methods for protein design for years, most of which fall into 2 categories.
One is trying to actually model the physical process by which proteins fold to adopt their shape. And more recently, deep learning methods, which sort of use kind of pattern recognition methods to identify sequences which will fold up to the structure that has the function that you want. So they both are trying to solve the problem of, given a new function, like we want to cure cancer or break down plastic or stop degenerative disease or capture sunlight, energy from sunlight more efficiently. Given a description of that problem, the design methods design a new protein which has that function. And most recently, the deep learning methods AI methods have been more powerful.
Baker says the technology is much like DALL-E, a recent AI system that generates images for whatever description you write into the program.
Now we can tell the AI design method, design a protein which blocks this cancer target, or design a protein which blocks this virus, and it will design a protein. Once we have that design, which is on the computer, we can make a synthetic gene which encodes that protein and put it into bacteria, and the bacteria become a factory for making that protein. And then we can get that protein out and test to see whether it actually blocks the cancer protein or blocks the virus protein.
Baker believes that these developments in AI have launched humans into a new era of technological revolution.
And the reason why it's exciting is that the study of biology has really been the study of all these remarkable proteins in our bodies that do these amazing things. And now it's very exciting to be able to make new proteins from scratch to solve new problems. And I think we're going to see really across a wide range of human endeavors in medicine, in materials, in energy, in bioremediation, that new proteins can really push us much further than where we've been and solve currently unsolved problems.
And protein creation is just one example of how artificial intelligence gives researchers the ability to push past what was once impossible.
We have made a lot of progress, but there's even taller mountains to climb. For example, one of the problems we're working on is plastic degradation, because there's so much plastic accumulating in the environment. And we still need better methods to solve that problem. And for other problems, we're breaking down toxic compounds. So the AI methods have been powerful for solving relatively simple problems, but we're now currently extending those to more and more complex problems.
Another use that Leibovitz sees is AI's ability to find out-of-the-box answers within large amounts of data.
For example, statin medications have been available for many years. It took a number of years until they were out where, kind of on a hypothesis basis, someone investigated, does diabetes seem to be nudged to be a little bit more likely for patients on these statin medications? And sure enough, that was the case. There was data that supported that. These sorts of things shouldn't take as long to be reported. Additional large data set investigations for unexpected associations and outcomes could be much more automated, where we can have higher confidence level for the interventions that we're giving to patients and have a better understanding of any negative downstream implications.
Though the benefits of statin medications far outweigh its slight effect on blood sugar, Leibovitz said it would have been useful for scientists to know this link from the start. He's hopeful that with AI, these connections will be made much earlier in the research and development process. But as he's previously mentioned, these tools aren't ready to be fully trusted to patients without supervision.
It's not perfect by any means, needs validation. There's hallucination aspects of the current generation of these tools. That being said, this shows the possibility of the example I provided, where okay, let's extend it to the full chart content assimilated for this patient who I'm taking care of right now. And what should I pay attention to from a physician perspective? And you can think, well, wait, can't the patient do it themselves? We're now sharing records with patients. Patients can have their charts sifted and come up with actionable recommendations. These tools aren't ready for prime time, and they need that expert supervision at this point, just like with Dr. Google at the moment. Lots of problems from looking for things and rare things being weighted inappropriately, that sort of thing. So we're nowhere near ready for this sort of thing yet, but the assisting and making those interactions much more meaningful has that possibility.
When we finally get a program that's trusted to perform all of these tasks, Leibovitz is hopeful the medical community will change for the better. Doctors won't face as high burnout rates, and patients will feel a better connection with their physician. And though people may think the next step is for AI to replace in-person doctor appointments altogether, Leibovitz says these programs will never be able to understand the nuance of human lives or build trust equal to a human connection.
Much of what we do in medicine is not very clear-cut. There's patient values, perspectives, the fact that it's their daughter's wedding the next week is going to impact on their decision to go ahead with different things at different times, or even try new medications and things at different times, or adjust doses. All of those sorts of important nuances and understanding how a relative's health is impacting their health and day to day, and being able to connect and understand the family, those sorts of things, one needs that human-human relationship. And there's evidence indicating how important that relationship is to health outcomes. Independent of the facts of the matter, it's that relationship has value. So this is not going to substitute, but the hope is this will actually help forge those connections by having more physician time to spend with patients, because it frees them from some of the drudgery, and then make those interactions that much more meaningful.
You can find more information about Dr. David Leibovitz, Dr. David Baker, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield. Coming up next week on Radio Health Journal.
Be gentle with yourself. Society isn't. You did nothing wrong. You absolutely did nothing to deserve this loss.
Ending the stigma around early pregnancy loss.
Then childhood obesity and the food marketing industry.
It's an unfortunate thing to say, but if it's marketed to kids, it's probably not good for you.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
High caseloads, low pay, and just working conditions that aren't conducive to the overall wellness of social workers or any employee for that matter.
Social work burnout in the U.S. Then.
Has a cave, has a glacier, has mountains, has 1,000-year-old trees.
Want to wander off the beaten path this summer? Consider road tripping by RV. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.